Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Olson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. Let's get a little science-y today and talk about vitamin D. Back when I was doing primary care, vitamin D was all the rage, but these days things have settled down a bit. We now have an abundance of data that tells us what vitamin D can and what it can't do for our health. Recently, one of my clients showed me her lab results and her vitamin D level was low. She mentioned that every year her doctor suggests she takes a vitamin D supplement, which she occasionally does, but more often than not, she forgets. With changing guidelines on how to screen for vitamin D and variation in how we approach a deficiency in the absence of overt disease, I thought this topic was worth covering, especially since carrying excess weight can predispose people to low vitamin D levels. We all need vitamin D to help us absorb calcium and to keep our bones strong. We're learning that vitamin D is important for other areas of health, too. 100 years ago, we saw vitamin D deficiency show up as something called rickets in children or osteomalacia in adults. You may have seen people whose legs bow out, leaving a lot of space between the knees when standing with the feet and ankles together. That can be a sign of rickets in a baby or toddler. In adults, severe vitamin D deficiency can be associated with bone problems, meaning new bone can't be formed as older bone cells die and need to be replaced. This can cause thinning of the bones, bone pain, or even fractures. These days, we often find low vitamin D levels without any associated disease because people get screened for it. Or occasionally we find it as part of an evaluation for osteoporosis, which is the bone thinning that many of us get as we age, and that can lead to broken bones like hip fractures from a fall. Is your grandmother shorter now than she was as a young adult? That's likely to be related to osteoporosis, which can be related to vitamin D deficiency. Based on trials of vitamin D supplementation, the National Academy of Medicine recommends keeping levels between 20 and 40 nanograms per milliliter because less than 20 are not optimal for bone health. Some groups recommend levels of 30 or more to prevent bone fractures in older age. Groups like the National Osteoporosis Foundation and the American Geriatric Society. So why don't we all just take extra vitamin D to prevent these problems? Here's why. Not all supplements are benign. In fact, high levels of vitamin D, blood levels over 50 nanograms per milliliter, have been associated with an increased risk of fractures or broken bones. And levels of 30 to 50 have been correlated with certain types of cancer, like pancreatic or prostate cancer. There's even a concern about increased mortality, meaning death, if you oversupplement vitamin D. So how do we determine if someone has enough vitamin D, given the controversy about optimal levels? Well, everyone agrees that if your level is under 12 nanograms per milliliter, you have deficiency. If it's 12 to 20, you have vitamin D insufficiency. And many experts say that if your level is greater than 20 or perhaps 30, you have enough. Experts also agree that if you're supplementing and your level reaches 100 or higher, you have too much. 100 nanograms per milliliter or more is considered to be vitamin D toxicity. Here's an important side note. Vitamin D levels can be reported in nanograms per milliliter or nanomoles per liter. Most local labs in my area report the numbers in nanograms per milliliter, but the cutoff of under 20 being insufficient and over 100 being toxic, those levels are based on that nanogram per milliliter result. If your local lab reports the numbers in nanomoles per liter, you'll have a different cutoff, which you can find on your lab report. They'll also give you the normal range for your specific lab when they report the results. Let's talk about causes of vitamin D deficiency. You're either getting not enough in, too much out, or we might see ineffective use of vitamin D. Not enough vitamin D coming into the body suggests you're not eating enough foods rich in vitamin D, like sockeye salmon, canned tuna, milk, yogurt, or sardines. You can even get a little vitamin D through the yolk of eggs. Another source is fortified cereals, but I generally don't recommend most cereals when you're trying to get healthier and lose weight, as they often have hidden ultra-processed ingredients. A lot of today's cereals are more like an ultra-processed dessert. In 2010, the National Academy of Medicine released a recommendation for healthy non-pregnant adults to take 600 international units of vitamin D daily as the recommended daily allowance, increasing to 800 IUs after age 70. Now, that can be obtained through a combination of food and supplements. How do you know if you're getting enough? You can do a quick and easy vitamin D audit with the help of the internet. Simply type into Google, for example, how much vitamin D is in a cup of raw spinach with 1 egg. That's what I had for breakfast yesterday. It turns out there is 0 vitamin D in my spinach and about 25 international units of vitamin D in my egg. So I have a pretty long way to go after breakfast to reach my 600 international units daily. But if you're eating cereal, your cup of milk will have about 120 IUs in it, and your cereal may or may not have been fortified with vitamin D, depending on what type of cereal you're eating. It can be tough to get enough vitamin D from food alone, which is why we also take in some vitamin D through our skin from sun exposure. And of course, you can also take a supplement. Now let's switch gears and look at other problems with getting enough vitamin D into the body. Malabsorption means you're not absorbing enough vitamin D from your diet due to stomach or intestinal problems, maybe gastric bypass surgery. Malabsorption is also caused by pancreatic insufficiency, meaning your pancreas isn't functioning normally, so you don't absorb vitamin D as you should. Not absorbing vitamin D through the skin might happen due to inadequate sunlight exposure, let's say during the winter months, darker skin pigment that prevents absorption of vitamin D, or wearing full coverage sunscreen or clothing. We all know we should limit our sun exposure to prevent skin cancer, but a casualty of that is less vitamin D absorption. There are disease states that impair our absorption or activation of vitamin D, including excess weight, obesity, liver, kidney, or parathyroid disease. In this podcast and in my program, excess weight is something we see often as a cause of low vitamin D levels. Speaking of my program, I just want to give a shout out to all of the podcast listeners who have recently joined Smart Weight Loss Coaching. We're so excited to have you and can't wait to see you reach your happy and healthy weight. Back to vitamin D. We talked about not getting enough, but what about losing vitamin D? Rather than getting too little vitamin D in, some people have too much going out. You might lose vitamin D if you're taking certain medications. For example, some anti-seizure medications can cause the body to break down vitamin D too quickly. Some people have an ineffective use of vitamin D. For example, some people don't have enough of the binding protein for vitamin D. They have vitamin D floating around their system, but the body can't lock it into place because there's not enough vitamin D binding protein that connects vitamin D to receptors on the cell's surface. Another version of the ineffective use of vitamin D is if your end organs, let's say your bones, are resistant to vitamin D. You have the vitamin D, but the bones don't recognize and use it even though they need it. These issues are all less common than simply not taking in enough vitamin D through the diet or sunshine. Epidemiologic research tells us that the risks of cancer and infectious autoimmune and cardiovascular diseases are higher when vitamin D levels are less than 20 nanograms per milliliter. We also know that the risk of these diseases will decrease with higher vitamin D concentrations. However, and this is important, no convincing randomized trials have demonstrated that vitamin D supplements decrease cancer risk or improve prognosis. Nor does vitamin D supplementation decrease the risk of cardiovascular disease or metabolic disease. In addition, there are no prospective studies to define optimal vitamin D levels for extraskeletal health, meaning we don't know the optimal level for anything other than bone health. That's why experts don't suggest vitamin D supplementation beyond what is required for bone health. That's where we have the facts. Just to clarify further, studies don't support taking vitamin D supplements to reduce the risk of cancer, to improve muscle strength, or to reduce the risk of falls in the elderly. Because of all this, the most current research supports not screening adults for vitamin D deficiency. This is a major shift. I'm sure many people listening have had their vitamin D levels checked in the past few years. I know I have, but I don't plan to have mine checked the next time I get my blood sugar or cholesterol checked. That's just me. If you have been screened and your levels are under 20, gentle replacement to get your levels a bit higher, more like 30 or 40, might be recommended. Of course, I'm not your doctor, so you should be discussing this with your own primary care provider who knows what's best for you specifically. Also, as you can tell, this research is ever evolving. What's true today in the middle of 2024 may be refined or even changed in the future based on changes in population health or new data. In terms of specific diseases linked to low vitamin D, low levels are associated with a higher risk of multiple sclerosis, MS. But data on other autoimmune diseases, asthma, allergies, and infections has been less clear. There's absolutely no role for vitamin D supplementation in the treatment or prevention of COVID, for example. That's been well studied. We have data showing a slightly increased risk of heart disease in folks with very low levels of vitamin D, but supplementation doesn't appear to change heart outcomes, so it's not recommended that we use supplements to prevent heart problems or death from cardiovascular disease. It simply doesn't work. We know that vitamin D may impact both type 1 and type 2 diabetes. But when it comes to prevention of type 2 diabetes, the impact of vitamin D supplementation is modest. In a large study of people with pre-diabetes, meaning a blood sugar of 100 to 125, supplementing vitamin D reduced the risk of going from pre-diabetes to diabetes by 3%. It's not nothing, but it's not a hugely impressive intervention. You can reduce that rate further by getting exercise. How about mortality? Do we live longer if we supplement with vitamin D? The results of this are fairly subtle too. Among older adults who are not critically ill and who are deficient, they do seem to live a bit longer if we supplement their vitamin D levels. But for adults who aren't deficient or who are more ill, there's no benefit. So what are we left with? For healthy, low-risk adults, we suggest not routinely screening for vitamin D deficiency anymore. Rather than screen, experts suggest an intake of 600 to 800 international units of vitamin D daily, either from food, supplements, or both. For high-risk adults in whom there's a clinical suspicion that the usual doses are inadequate, meaning older homebound or institutionalized individuals, those with very limited sun exposure, osteoporosis, malabsorption, and so on, measuring the 25-hydroxy vitamin D concentration is useful because supplementation would be recommended. If you have had your vitamin D level checked and you have true deficiency, meaning a level under 12 nanograms per milliliter, your doctor may recommend tests to determine why you're so deficient, in addition to recommending supplementation. If you're only mildly insufficient, but not fully deficient in vitamin D, there may be benefits to supplementation, but your doctor will want to give you guidance so you don't overdo it on the supplements. And you should recognize that the supplementation may not result in better health outcomes. If you're tested and your levels are very high due to supplements, you'll want to back off so as not to become toxic from vitamin D. If your doctor does recommend a supplement, they'll most likely recommend vitamin D3, which is also called cholecalciferol. This is most often recommended instead of vitamin D2. What about calcium? Women 50 and up and men in their 70s and beyond should be consuming about 1,200 milligrams of calcium daily from any combination of diet and supplements, according to the latest guidelines. Because this is a weight loss as well as a health and longevity podcast, let me say a few words about weight and vitamin D levels. First of all, we definitely see a correlation between low vitamin D levels and the chronic disease of obesity. It's not fully understood why low vitamin D would contribute to obesity, nor do we believe that supplementing low vitamin D levels will necessarily cause weight loss. Stay tuned because this is a hot field of research and the news is ever evolving. So let's talk about your NBA for this week, your next best action. If you have prediabetes, maybe you'll decide to ask your doctor if getting some exercise and taking vitamin D supplements is the right next step for you to reduce your risk of progression to full-on type 2 diabetes. Or perhaps you're taking supplements that aren't grounded in science. No problem. This is simply a nudge to make an appointment with your primary care provider to get guidance that's specific to your individual health history and needs. Or maybe your NBA is to head over to smartweightlosscoaching.com to learn more about our program or our women's wellness retreat that's coming up in the fall of 2024. Sign up now before registration fills up. We'd love to meet you. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.